let's go to our COVID segment for today. A new subvariant of COVID-19 is spreading particularly in Singapore and Thailand. While health ministers and scientists are busy managing the situation, they're also preparing for another pandemic. Here's the special report. Health officials and scientists from all over the world are in Geneva for the World Health Organization's yearly assembly. On top of the agenda, to find ways of improving readiness for deadly diseases. But even before the assembly, the aim to finalize a pandemic treaty that has been on the table for more than 2 years was shelved. Though the proposed treaty include learnings from the COVID-19 pandemic and substantial scientific data about viruses, the discussions ran into disagreements over info and technology sharing between countries. This even if the recent pandemic showed us the need for global cooperation because pathogens have no regard for territories and borders. WHO officials now call on member countries to set aside differences for the sake of humanity.
I remain confident that you still will, because where there is a will, there is a way.
These concerns were raised during a recent virtual forum dubbed as Fair Treatment, the place for therapeutics in future pandemics.
Imagining a situation where we have a new pandemic and we can't make a vaccine, or it takes 10 years to make a vaccine, not 1 year.
Aside from info and tech sharing, the panel zeroed in on other learnings from the COVID-19 pandemic, including the need to give therapeutics or meds given post-exposure the same attention given to testing and vaccines when a new outbreak occurs. Dr. Sharon Lewin noted that if the same speed of research and approval was applied to antiviral drugs during the first wave of COVID-19, millions of lives could have been saved. And even before the unfortunate fate of the pandemic accord in Geneva this week, scientists and groups have been racing against time to prepare for the next battle against a virus. Like the privately funded Coming Global Center for Pandemic Therapeutics that aims to develop technologies to control future pandemics.
We should be able to stop infectious outbreaks and prevent them from becoming epidemics and pandemics. Both treatment and vaccines, and of course diagnostics, need to be available where and when infectious outbreaks occur.
With a failure to reach an accord against future pandemics, the WHO Assembly can still move to change its international health regulations and basically encourage nations to work together for a healthier and safer planet. Ma'am, it's kind of unfortunate, nagmi-meeting ang WHO members and ministers doon sa Geneva ngayon. Pero yung accord for the next pandemic ay hindi pa mapirmahan o hindi pa magkasundo ang mga leaders na yan. Alam natin, at ang reason nila, Ma'am Ami and Ronald, ay dahil they don't want to to share information at saka yung mga scientific studies nila ng basta-basta, which is weird because
kahit mapirmahan yung accord na yan, halimbawa, we know naman kung ano nangyari doon sa COVID. Tinago ng China. They sat on the information for a long time.
That's true.
Kaya actually, ang pinakamabilis na nag-respond yung dating nag-suffer dahil nga dyan sa lack of information na yan, which was Taiwan. Nung SARS kasi, they were kept, up to now, they are kept out of the World Health Organization. Wala silang impormasyon, kaya namatayan sila, kakunti tao nila. That's 27 million people. Maraming namatay sa kanila from SARS. So ngayon, paglabas ng mga balita na yon na sinupress ng China in November-December of 2019, alam ko yan kasi may mga kamag-anak ako nung nasa Taiwan noon. They were telling me, January pa lang, nagkalat na ng mask ang Taiwan, free. Meron silang mga masking stations, meron silang isolation. Kapag ikaw nag-in-isolate ka sa bahay mo dahil may sakit ka, may monitoring sila. Kapag ikaw nakita nila na lumabas, may monitoring sila through cellphone na ganun ka-sophisticated ang monitoring nila and tracking. Pag ikaw nakita na lumabas, nag-violate ng isolation, ang laki-laki ng fine, so big. Kaya ganyan. Pero sumunod tayo kasi alam naman natin kasi kung sino yung nag-idolize noon sa China.
Yan nga yung problema, Ami, Joby. Dahil sa kabila ng napakaraming ebidensya, ay kahit ang World Health Organization ay wala pa ring definitive
Yes.
analysis kung paano nagsimula ang COVID. Kaya ang hirap pigilan yung susunod kung walang ganong klaseng assessment, di
Yeah.
ba?
Yeah.
Dahil mahalaga yun para ma-prevent yung susunod na pandemic.
Because
kailangan malinaw. Paano ba nagsimula itong pandemic na ito na very earth-shaking, di ba?
It's a given that something bad will eventually happen again, di ba? So dapat yung learnings natin from COVID-19 about 3 years ago, parang dapat we know how to handle this na, no? Sa mga susunod. Pero kung walang pagkakaisa, I think across borders and territories, mami ka, ang labo nun, di ba? Parang papaano? Parang taguan tayo ng impormasyon. Parang ganun ang mangyayari.
Pero
Kaya nga niyayaw na bakit daw pinapangalan sa Wuhan yung virus? Why do you call it a Wuhan virus? Doon ang galing Paano? Bakit yung Ebola?
At kung titignan natin, yung ilang mga presidente na magkakatulad ng aura, katulad ni President Trump, si President Bolsonaro ng Brazil, si President Duterte, etc. Lahat sila pare-pareho na minaliit nila yung pandemic at the start. Di ba? Pare-pareho sila
Pero
ng
at least si
narrative.
Trump, afterwards, he poured a lot of resources para madaliin yung pag-develop ng vaccine.
Yeah. So,
After.
After.
Nung nakita niya. Although may napakarami namatay sa US, of course.
as a last point, another good mga ideas coming from that forum at saka yung nangyayari sa Geneva ngayon. Yan, nakalagay na naman sa private sector at saka sa mga private groups yung paghahanap ng mga kasagutan. Imbis na parang global na dapat yung response natin dito. No?
Yes.
Katulad ng mga scientists, hindi sila tumitigil kahit na may mga politika na ganyan. Isipin nyo, nalaman na nila from the past COVID experience natin na kung sabay-sabay na pinag-aaralan yung therapeutics, yung testing, at saka yung vaccine, a lot of lives ang dapat ang na-save from that experience natin na bad. So parang dapat hindi na maulit pagka nagkaroon ulit ng bagong virus na lalabanan tayo, na parang dapat alam na natin ang gagawin, lalo na sa gamot.
Well, let's hope na yung government natin narinig yan. Kasi remember, nag-eksperimento tayo ng antiviral based sa halimbawa virgin coconut oil. Hanggang ngayon, I'm not sure kung tapos na yung experimentation na yun. And remember si Father,
Nagpalit na kasi ng mga opisyal, di ba? Dati may makausap kayo sa chiefs Yeah.
Saka si Father Nick Austriaco, remember, we talked to him a lot noon. And he was actually complaining na balik scientist na siya. He wasn't getting enough support for his research.
I think we have
on
a
his
contingent
yeast-based vaccine.
We have a contingent
Diba?
galing sa atin na umattend ng WHO Assembly in Geneva. Nandun yata si Secretary Herbosa. Based on mga tweets niya or mga posts niya sa kanyang social media. So I hope yung mga narinig niya doon maitawid dito.
Lalo na, marami tayong mga quack doctor sa social media na kung ano-ano yung mga sinasabi na gamot daw sa COVID.
Well, ang statement ngayon ng DOH tungkol dyan sa flirt variants, mababa pa rin naman daw yung COVID cases natin dito, not a cause for concern.
Yes,
sa ngayon yan, today.
Yes.
So araw-araw nagmo-monitor na naman tayo.
Nag-monitor tayo. Tsaka alam nyo na po, viewers, ang inyong gagawin. Kung hindi kayo comfortable, alam nyo na you can mask up o kaya ay iwas sa crowd. So you know what to do.
Isolation.
Isolation. And kung meron pang iba mga updates, we'll give you that sa mga iba naming programs today hanggang sa mga susunod na pagkakataon.